Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. All right, so you've done your initial evaluation, you've gotten that home exercise sheet. Now what? Well, that is what we are going to discuss in this video, and that is the follow-up treatment or the treatment visit. This is what people typically think about when they think about physical therapy, so this is what they're going to describe. We'll break down some of the components of it. Now, this may not be an all-encompassing list of everything. It can really depend upon what kind of setting that you're going to, what your condition is, or the therapist that you are seeing. However, this is, again, a general overview, and follow-up visits typically follow this kind of outline. The first thing that your therapist is going to do when you walk in that clinic door is to ask you some questions, because we want to know how you are doing. So we're probably going to straight up ask you, how are you feeling today? We want to know what your symptoms are doing when you come in. Are you feeling better? Are you feeling the same? Or are you feeling worse? We may ask you to quantify that. We may ask you again some more questions to kind of get some more information about that. We may ask you, how have you been feeling since the last visit? Because you could have left out of there feeling fantastic, but over the next few days, some of the symptoms may come back. Likewise, we may ask you what kind of activities or things you may have gotten back into doing. These are typically the things that you may have told us that you were limited in at your initial evaluation. We do want to know, are you getting back to being able to do any of those things, even if you have to do them with modifications or that you're still limited in doing them. We want to know about that. And of course, we're going to ask you, are you doing your home exercises? We want to know that you are doing this. You may wonder, why do you want to know all that information? Well, we want to know if what we are doing is benefiting you. So did the treatment that we did last time, did that again help you? Are you feeling better? Are you moving better? Things like that. Are the things that you're doing at home, are they providing a benefit? Because if it's not, if it's staying the same or possibly getting worse, which some happens to a few people, we may have to change up what we are doing in therapy, or if other things arise, we may have to refer you to another medical provider. Following that gathering of information from that your therapist is going to ask you those questions, there may be a variety of things that you and your therapist will do. Again, this is not in any particular order. Again, it depends upon what kind of setting that you're in, the therapist that you're seeing, the condition that you're dealing with. It all varies. Very often, the first thing that a therapist will do with you is something with their hands on you, which we call manual therapy. Manual therapy can include many different things, but really just think about it. It's any time that your therapist puts their hands on you to assist you with, again, decreasing your pain, increasing your mobility, things like that. Now, we're going to discuss a few of the things kind of generally, kind of broadly that your therapist may do with you. One manual therapy technique that many people know and is very often portrayed as physical therapy is stretching. So as you come in, again, this could be that you're dealing with pain or tightness. Your therapist may have you lay on a treatment table and they will stretch you. The goal of this, again, is to increase your motion. Another activity that your therapist may do with you is what we call soft tissue manipulation. Most people think of this as a massage, and it can be pretty close to it. However, it's not very often that same kind of massage. Like if you go to a massage salon that they do, this is much more specific. So this is for somebody, maybe you're dealing with some soft tissue issues. So a muscle is very tight. Maybe you have like a knot or something in it. Maybe it's something very painful. And we'll use our hands to kind of help relax that. Again, this can be beneficial for decreasing pain, increasing mobility, things like that. There's another manual therapy technique that many therapists pride themselves in being able to do, and they spend a lot of time in educating themselves and learning, and that is joint mobilizations. These are when a therapist places their hand around one of your joints, and they apply a force to that joint, and it causes some sort of movement of the joint. So the goal of doing this, again, to help decrease pain, because this does facilitate little receptors that go on in your joint, so it can help decrease pain. It can also help improve motion and movement, so your therapist could utilize it for that. Included in joint mobilization is what we call a manipulation. Easiest way to explain it, think about when somebody pops their back or pops their knuckles. It is a low amplitude, which means it's a very small amount that the joint actually moves. High velocity, which is very fast maneuver. So it's that quick little, we may put you in position really quick and we get a little pop. Therapists, again, can utilize these techniques to, again, help with pain and or mobility. Additionally, there are manual therapy techniques such as dry needling or cupping. The goal for these to, again, you have something going on in the muscle, and applying a cup or the needle can help decrease the pain and increase the mobility. Now this, again, is not an all-encompassing list of the manual therapy techniques or approaches. Your therapist may or may not choose to use some of these. Again, it depends upon your condition, what you're being seen for, the setting that you're in, and the therapist. So all of that may or may not be used. Just keep that in mind. And if you have any questions, talk to your therapist about it. A big part of the treatment visit is the exercise. Now, we use exercise as more of a broad term that really just encompasses any kind of movement or motion that we do. It's just, again, it's just an easy way to explain it. And it can come in all different forms, and every bit of it has a specific use to help you reach your goals. Again, this is not in any particular order. Your therapist will, again, choose what order, what activities, exercises to utilize with you. One form of exercise that many therapists like to utilize is cardiovascular. Now, this is something like walking, jogging, running on a treadmill, utilizing an elliptical, riding a bicycle, either with your legs or your arms, something like that. We may have all seen this or experienced at one point or another. The goal of doing cardiovascular exercise in therapy could be to just warm up the tissue. Maybe when you come in that you may just have not been moving a lot that day. So we want to get that blood flowing so that your tissue moves a little bit better. We may be training you to do something functional, such as walking. So walking on the treadmill can help you train for that, can work towards that. Or even just doing, again, general cardiovascular activities that we get your heart rate up, just help you carry over to doing basic function. Additionally, we may use it for something to stretch you. For an example, someone coming in with a very, very stiff knee, we could have them ride the bicycle, and that can help loosen up their knee. Another form of exercise that therapists use is some sort of stretching or mobility. Again, depending upon the issue that you have, your therapist may have you do static stretching, which is this kind of like you just stretch the muscle or the joint and you hold it, or maybe something a little bit more dynamic where you're getting some movement and stretching into that range that you don't have. Now, these exercises, again, are used at the therapist's discretion based upon the condition that you are dealing with. The biggest one that we like to utilize in therapy is something that is strengthening. So that's what people typically think about with exercise, that exercise is a strengthening activity. Now, this can, again, encompass many, many different things in it. We could do something in isolation. Take, for example, again, that person that has a knee issue, and we want to work on strengthening the quads, those big muscles in the front of your thigh. We may have you just sit on the side of the table and straighten your leg out. That's an isolation exercise. Or we may say, no, we want to do something that is more compound and uses more muscle groups. With that, we may have you do a standing squat. So you're standing up, you squat down, and you come back up. So not only is it going to use those big muscles in the front of your thigh, it's going to use the ones in the back. It's going to use your back muscles, your core, your abs, your calves. It's going to utilize all of that. So we'll use these in a combination to help you reach those goals. Now, with those compound exercises, we may do something that is functional. So something that is very close to an activity that you are wanting to go back to do. We very often do these with people with trying to get back to a job. So with our jobs, we can do some sort of physical activity, which could be carrying, pushing, pulling, walking upstairs. Maybe we just have to walk a lot. So we're going to do exercises or activities that mimic those, that are very, very similar to what you're doing. Again, we're going to control it. You may not be doing it at the same level that you do at work, or again, if you're doing a sport, we're going to do something very similar to the sport to get you ready to go back to doing it. Another form of strengthening that we like to utilize is coordination. Very often when people have difficulty with their balance, or maybe they're coming back from a surgery, or maybe we've stretched them and they have a new amount of range, we need to do some coordination exercises. So that, again, challenges the balance, challenges the use of whatever that they've been dealing with to help them get back that function. Now, keep in mind, all of these things can fall under exercises. There could be many, many more things that your therapist would like to utilize. This is something that is very, very broad. And I will say, as a therapist, we come up with some pretty creative things to do for you to help reach those goals that we classify under exercise. And of course, if you ever have questions about it, please talk to your therapist about it. One of the last things that you will experience during the treatment visit is called modalities. Now, during your treatment session, you may have experienced some things like aching, soreness, some possible swelling. This is completely normal. This does happen because typically when we went from a period of being inactive or dealing with pain and we start doing these new exercises and movements, we may get some of these symptoms that come up. Now, your therapist will be checking in with you during your treatment session, talking to you about how are you feeling, how are your symptoms doing. They will be monitoring you during that whole time. But again, however, we may get some of these things that arise. So we utilize something such as heat or ice, the electrical stimulation, which is kind of like a TENS unit, ultrasound, traction, something called a vasopneumatic machine, so it provides like a compression on you to calm those symptoms down. Now, I will say the thing that provides you the most benefit are the hands-on techniques that your therapist utilizes and those exercises that you do both in therapy and at home. Modalities are kind of a secondary thing that can, again, help you just feel better, help you just move a little bit better, but you're going to get your biggest bang for the buck in your therapy with those exercises and activities that your therapist gives you. Typically, we kind of joke that the modalities are just that little treat at the end. And I will say very often, when you get off of one of those, you're going to feel really, really good. After all of that, your therapist may or may not ask you how you're feeling. And of course, they're probably going to talk to you throughout your session to kind of get a gauge. How does this feel? How do your symptoms feel? Things like that, especially at the end. The reason why is that, again, we just want to know your response during the treatment session. We want to know if we did this exercise or this activity, how did it affect your symptoms? Do you feel like it helped you? Do you feel like, man, it really didn't do anything? Or no, it may have caused this issue here or there. That helps us guide the treatment at your future treatment visits. Based upon the information that your therapist got from you, they may adjust your treatment plan by saying, wow, they did very well today, so we're going to add some more things in next time. Or, they still had some difficulty with this and that. We're going to keep that in at this same level. Then after that, they're going to schedule you for your next visit if you haven't already done that. Now, the work for us as your therapist isn't quite over yet. We're going to document everything that went on during the treatment session, from everything from the time that you walked in the door, the things that you told us, all the exercises that you do, and everything that we may have saw or that you told us again during the treatment session. We utilize all this information to help guide your treatment going into the next treatment visit. And at each treatment visit, we are wanting to progress you. Now, we progress through either increasing, the exercises that you do, maybe going to much more difficult ones. We may increase the repetitions. We may increase the weight. So basically, at every visit, we try to build upon the last one to progress you more and more to your goals. There you go. That is the treatment visit. Now, again, your therapist may or may not utilize some of the things I talked about. It may go in a different order than we did, or again, they may use some of the things or they may not. Again, it's always up to the therapist's discretion based upon the setting and the condition that you are dealing with. If you're curious about the initial evaluation, you can check out the description below. It will have a link to the initial evaluation video along with the home exercise program video. Thank you for tuning into the video. If you enjoyed it, please hit that thumbs up button. If you have a question or comment, drop them down below. And please consider subscribing to the channel, because all this information that is provided is to keep you strong and healthy.